COVID cases continue to surge across the capital region, and contact tracing plays a major role in containing the spread.
Earlier this year, guidelines required 30 contact tracers per 100,000 residents. The state says as a whole, the capital region meets their contact tracing guidelines. But right now, Saratoga County only has 23 in addition to staff department members. Jacquie Slater is among those with positive tests who still haven't been contacted.
Amy Gregoire isn't in San Francisco. She's in a room without a view in Saratoga Hospital. Diagnosed with COVID pneumonia, she tested positive for the virus on November 27th.
I was holding my own at home pretty well, but the shortness of breath was getting worse.
A nurse by trade, Amy knows where she caught the virus, but she never got a call from the Saratoga County Health Department to contact trace, even though she called them on November 30th.
He basically said, okay, we're really busy, and took my name, my number. He says somebody will get a hold of you. Haven't heard a thing even as of now.
Amy is not alone. I live in Saratoga Springs and tested positive at Malta Med last week. So far, no call from a contact tracer. I also spoke with Amanda from Malta, who tested positive before Thanksgiving.
And I still haven't gotten a call from the health department. Honestly, I think it's so frustrating and ridiculous.
In Saratoga Springs, sources with the city say after a city hall employee tested positive last month, many on their close contacts were never called by the county. On Tuesday morning, Clifton Park Supervisor Phil Barrett weighed in on the issue.
The county leadership needs to do a better job with communication and dissemination of information. I saw a picture the other day, and members of the control room, Albany's, Rensselaer, and Schenectady County, and they were all there and saying, hey, we're all working on this together. Saratoga County was not represented.
Since November 24th, Saratoga County's active cases jumped from 372 to 854. That's a 145% increase in just 2 weeks. NewsChannel 13 spoke with Saratoga County's newly appointed Commissioner of Public Health on Tuesday afternoon. He says given the surge, they're prioritizing who gets calls according to CDC and state guidelines. That includes first responders, people who live and work in congregate settings, high-risk individuals, and people whose test results are reported within 6 days. But in my case and Amanda's, our tests came back within 48 hours. And Amy is a nurse. Dr. Kuhles says some of the delays come from incomplete data being sent to them by the labs. Do you think you could get staffing up to the point where you could once again go back to contact tracing every case? Is that your hope?
I cannot predict the future. That is certainly our goal. We've added and continue to add county-based contact tracers.
Still, for many people in Saratoga County, the lack of follow-up is alarming, as other area counties seem to be in better shape.
I do know from where I work, we have to test all our employees, and in the batch that I was in, there were several employees and counties involved, and every other county contacted their employees.
Reporting in Saratoga Springs, Jacquie Slater, News Channel 13.